Welcome to Emergency Medical Care and First Aid, presented by the Grove Recovery Center. What is characterized as a medical emergency? A medical emergency is defined as an illness, injury, symptom, or condition so serious that a reasonable person would seek care right away to avoid severe harm. It could place the patient's health in serious jeopardy, cause serious impairment to bodily functions, or cause serious dysfunction of any bodily organ or part. Examples of medical emergencies include difficulty breathing, loss of consciousness, fainting, chest pain or pressure, uncontrolled bleeding, coughing blood or vomiting blood, sudden severe pain, poisoning, major injuries such as broken bones, sudden facial drooping or weakness in the arm or leg. Events that create medical emergencies are heart attack, hypertensive crisis, very high blood pressure, stroke, severe asthma or panic attack in some cases, loss of consciousness, seizure, severe injury with copious bleeding, swelling, pain, severe pain of an unknown origin, hypothermia, which means extremely high fever, coughing, or aspiration. What to do in a medical emergency? Stay calm and activate 911. If possible, instruct a second individual to do this while you remain with the victim. Inform a supervisor. Start CPR or rescue breathing if appropriate and you know the proper technique. Place an unconscious or semi-conscious victim in the recovery position. That will be on his or her side. In the case of first and or second degree burns, continuously apply cold running water to the affected area. Do not apply ice or any other type of cream or ointment. If there is a serious external bleeding, provide pressure to the wound with a clean cloth if possible. Do not apply a tourniquet unless the bleeding is clearly arterial, copious, and coming in large spurts. When an individual has fallen, do not move the person if he or she is not in imminent danger and a body part appears to be at an odd angle or is automatically incorrect position. He or she complains of pain, numbness, tingling in the back or elsewhere below the waist. Imminent danger. Regardless of the person's medical condition, an individual must be moved if he or she is in an area where additional injury is likely to occur, for example, collapsing of a building, the middle of a busy road, in a fire, or where an explosion is likely to occur. Runs the risk of being electrocuted by down power lines in close proximity, especially if he or she is in water, and can be assumed to be at risk of death or serious bodily injury if not moved, for example, in a lake. Heart attack description. A portion of the heart muscle becomes injured or dies due to lack of blood or oxygen to the area. Often, there is unexpected loss of heart function, breathing, and consciousness. Results from an electrical disturbance in the heart, which may be caused by physical anomalies such as a blood clot. The pumping action of the heart is disrupted. Blood flow to the brain and the rest of the body is stopped or significantly decreased. Signs and symptoms of a heart attack. Sudden collapse, weakness or dizziness. Pulse is absent, erratic, or very weak. Breathing stops or becomes very slow, very fast, or erratic. Shortness of breath or gasping for air may occur. Skin becomes pale or gray. An individual may complain of pressure or pain in the chest, usually mid-sternum, or pain tingling in or radiating from the left shoulder, arm, jaw, or neck. Victim may complain of nausea and or may experience vomiting and sweating increases. Heart attack continued. A heart attack may occur suddenly without warning, often occurs in people that seem very healthy. Individuals experiencing heart attacks are often in denial and attribute the symptoms to stomach problems, reflux, a pulled muscle, or a toothache. Treatment. Do not allow the victim to be alone. Observe an increase in symptoms or loss of consciousness. If either occurs, activate 911. If symptoms are very pronounced or last more than a few minutes, activate 911. If symptoms subside after a couple of moments, encourage or require the individual to seek medical attention as soon as possible. If necessary and trained, provide CPR or rescue breathing until EMS arrives. Respiratory stress or arrest. This happens when breathing is not adequate to provide oxygen to the brain, heart, and body. If breathing stops altogether, the heart will stop. If breathing is so slow or erratic that it does not adequately oxygenate the lungs, the heart will stop. In adults, the most common cause of respiratory distress or arrest are medical. In children, the most common cause is airway obstruction due to choking on an object. Signs and symptoms of respiratory distress or arrest. Skin may become blue-tinted, especially around the lips and at fingernail beds. Mental status changes may occur, increased confusion and/or irritability. Breathing may become labored, slow, fast, erratic, or non-existent. The chest does not rise and fall normally. The nostrils flare with each breath. And wheezing and/or gasping, shortness of breath may occur. Treatment of respiratory distress or arrest. The first thing we must do is believe the individual if he or she complains of shortness of breath or difficulty breathing. Determine whether the victim has a pre-existing respiratory condition such as asthma, emphysema, COPD, pneumonia, etc. Ask the person whether he or she uses a rescue inhaler. If the answer is yes, encourage its immediate use. Do not allow the victim to be alone. Observe for increase in symptoms or loss of consciousness. If either occurs, activate 911. If symptoms subside after a couple of moments, encourage or require the individual to seek medical attention as soon as possible. If necessary and trained, provide CPR or rescue breathing until EMS arrives. Human skin and burns. Skin has three basic layers. The epidermis is the outermost layer. It provides a barrier and creates skin tone. The dermis is the second layer. It contains tough connective tissue, hair follicles, and sweat glands. The deepest layer is the hypodermis. It is made of fat and connective tissue. First-degree burns happen on the outer layer of the skin, the epidermis. Second-degree burns happen both at the top and second layer of the skin. Third-degree burns means all three layers are damaged or destroyed by burns to the hypodermis. Signs and symptoms of first and second degree burns and treatment. First degree burns. Signs and symptoms may include redness, swelling, and pain. Treatment would involve an application of cold running water to prevent the burn from progressing and may alleviate some symptoms and signs. First degree burns generally heal on their own in about a week. Second degree burns. Signs and symptoms include blisters, swelling, severe pain, blotchiness, or redness. Treatment would involve application of cold running water to prevent the burn from progressing and may also decrease signs and symptoms. Second degree burns may require a skin graft and leave a scar. Signs and symptoms and treatment of third degree burns. Signs and symptoms include skin becoming white, yellow, or dark brown, A leathery or waxy texture may develop to the skin. Pain may or may not exist, depending on if nerves have been destroyed. A scar may form in blackened scab-like areas. Never attempt to treat third-degree burns. Activate 911. Burns. Run cool or cold running water to relieve signs and symptoms of first and second degree burns, and it also may prevent the burn from extending. Never apply cream, ointment, or butter to a burn. Because the skin regulates fluid loss, the victim of third degree or extensive second degree burns may become hypervolemic, low blood volume, and may require IV fluids. Due to a high risk of infections, burn must be kept clean and free from debris. Third degree burns, and depending on the area affected, second degree burns may be life-threatening and cause shock or respiratory distress. Next, we'll review common causes of burns. Common causes are fire, hot liquid or steam, hot metal, glass, or other objects, electrical currents, radiation from X-rays or radiation therapy to treat cancer, sunlight or ultraviolet light from the sun lamp or a tanning bed, chemicals such as strong acids, lye, paint thinner, or gasoline, and abuse. Traumatic injuries. Injuries may include soft tissue injuries, fractures, dislocation, neurological impairment, and bleeding. The definition of each of these injuries are listed on the slide. I will give you a moment to review. Treatment of injuries. For soft tissue injuries, ice may be applied for the first 24 to 48 hours at intervals of 20 minutes to reduce swelling. Fractures. Medical attention is required. The fracture may be splinted to prevent movement during transport. Dislocations. Medical attention is required. The joint may be splinted to prevent movement during transport. Neurological impairment. Medical attention is required. Observe for decreased consciousness, confusion, unequal or slowly reacting pupils, vomiting. Bleeding. Medical attention is required. Apply pressure to the area, but do not apply a tourniquet unless bleeding is excessive or arterial. This is the end of the training. Please complete the post test. Thank you.